Uterine prolapse. What's going on, Secoya Nation? Dr. Schilling bringing today's wellness wisdom. Today we're talking about a common problem for typically people are thinking postmenopausal, but it can happen at any point in your life. We have a younger woman who's dealing with that in her 40s, so it just depends on the person. So if you think about the uterus, it's the cradle for the baby, right? It's where the baby's nurtured, the fetus, if you will. So when you think about the uterus itself, it's like inability to nurture, inability to love, inability to like hold on to a relationship, hold on to a baby, things like that. These are themes that are related from a general theme as far as uterus goes, but they can also be related to struggles. So we typically think, because it's a female organ, struggles usually with men, but it can be any struggle in your life. So when you think about if you have, or you know someone who has trouble with their uterus, then think about inability to nurture, hold on to, care for, love, things like that. It can be nurturing self too. It doesn't have to be someone else, because I know a lot of women are very givers of themselves, and they tend to focus on everybody else instead of themselves, like mothers with children and stuff like that. But if it's them not nurturing themselves, not loving themselves, it's a very important thing to keep in mind. Sometimes there can be issues with they're fearing the future, or they think less of themselves based on the future. They could be facing some type of consequences from a partner, or from, typically because it's a reproductive organ, it's usually from something in the family. So they fear the health of their uterus or their ability to get pregnant. That's always, they can relate to the uterus, like a fear of not being able to get pregnant, things like that. It could be fear of losing a child, like literally just even conceiving, that's an interesting concept. The idea of having a baby or not being able to have a baby can affect the uterus, okay? Depends on where you are in your childbearing years and things like that. However, if you're fearing losing the pregnancy or things like that, that's really important for the uterus and the uterine health. So this is all the stuff that causes the musculature in the uterus to fail, the support structures, because the mind has a disconnect between the brain and the body. So the mind-body disconnect, and then the structure starts, of course, collapsing in, which is relevant to this as well, because if you think about a potential for a woman to avoid wanting to have intercourse, if the uterus is prolapsing through the vaginal canal, makes it kind of tough. That's another theme. So these are some things that you can consider for yourself, for someone you love or someone you know that is related to uterine prolapse, because it can be very uncomfortable. But if they are just devaluing themselves, they think less of themselves based on this fact, it's not the full picture. They have to consider what's leading up to that, what caused it in the first place. I mean, if they had some type of traumatic blow to their abdomen, more like their pelvis, because uterus sits way low. But if they had an injury, that's one thing to cause maybe potential damage to the nerves and the structures around the uterus. But most oftentimes, these are the threads, these are the themes that are relevant for a uterine prolapse. So take them into consideration, overlay them on your life, see how they affect you. Feel free to comment below. People love to comment, so if you have any ideas or questions about it, let us know. And otherwise, we'll bring you the wellness wisdom real soon. All right, guys, have a good one. Take care. Bye-bye.